We are celebrating the month of February as Black History Month, but our health is something that we should maintain each and every day. Proverbs, the 4th chapter, 20 through 22 says, "My son, attend to my words, incline thine ear unto my sayings. Let them not depart from thine eyes, keep them in the midst of thine heart. For they are life unto those that find them, and health to all their flesh." So the body that we have is a temple for God to use. So therefore we must maintain our health as best as we can. I am not here to diagnose or prognose diseases or ailments. I'm here to encourage each and every one of us to have a healthy life as much as possible. I'm just going to talk about screenings today. Our men have a tendency of not wanting to take care of their bodies until sometimes it's too late. I recommend that you have your healthcare provider to discuss your physical health, healthy lifestyle, healthy eating, because they have several recommendations they can give you. Some of the things that I recommend a man do when they get to be a certain age, basically about 45, is called a PSA. A PSA is a screening test that can be done by collecting blood. Also, you can have a prostate exam, which I'm sure you are familiar with. Also, a colonoscopy, which should be performed when a man reaches 45, especially in the Black community of men. Also, there are other things that you can do. It's called a fit test, where you will collect some stool and you will send it in, but again, talk to your healthcare provider to decide which test is appropriate for you. So a PSA, prostate exam, and a colon test is recommended. Also, they now have a test that's called a calcium scoring test, which is very good because what it is a screening test where they will basically kind of look at your heart and see if you have any plaque buildup, which can cause strokes or heart attacks. So therefore, again, talk to your healthcare provider. If you're having any signs of symptoms of any type of swelling, chest pain, any of those things can be major and it can be something minor. So it's best just to get these things done and to screen yourself, because you only have one body, which is the temple, and it is up to you to take care of it. So therefore, now I will talk to our Black women. We take care of everything, everybody, and we let our health go lacking. So I'm here to encourage each young lady, each woman, each mother, each grandmother, that our health is very important. Yet again, it is the temple that we use to give God praise, to work, to do different things. So it's up to us to take care of ourselves. And again, I ask you to talk to your healthcare provider as to at what age you need to be having different screening tests done. So screening is a way of just looking to see if everything is all right or if there is a potential problem that could be arising. I would like to start off with talking about mammograms. Mammograms are very important. If you have a family history of breast cancer, please talk to your healthcare provider to see when you need to start having a mammogram. Most of the time when a woman reaches 50, they need to start getting mammograms either annually or every 2 years. But again, it depends on what your healthcare provider recommends and what your insurance recommends. Also, women that are not able to have mammograms at this time, I recommend that you do a self breast exam once a month after you've had your monthly cycle. Then you check your breast. If you don't know how, Google it, and it will give you step-by-step instructions on how to do self-breast examinations. I also recommend Pap smears. Pap smears are usually from women 21 up to 65. Again, talk to your healthcare provider. Pap smears, also pelvic exams. A lot of women don't understand if you've had female surgery, that you still need to have a pelvic exam because you can develop cancers in other places. Also, I would like to recommend a bone density. Once you get between 60 and 65, again, it depends on your healthcare provider and what he recommends. Bone density or a DEXA screen, it measures the weakness and the strength of your bones. So I know you've seen commercials about Prolia and different medicines. You may hear people say they take Tums that has calcium, but again, I'm not saying take these things. I'm saying talk to your healthcare provider after you've had a bone density or DEXA scan. And also, I like to talk to also women. A calcium scoring test, just like the men, is a screening, and women have symptoms for us heart attacks that are different than men. A lot of times they have pain in their back and their shoulder blades. Therefore, you would probably think you might have indigestion. Again, I am not diagnosing, but I'm saying have a calcium scoring test. And the reason screening tests are so important, as I close, is that it helps you stay on top of your body. Your body, listen to your body. It lets you know when something is not right. And also it gives you a baseline. So if, say for instance, if you have a mammogram every 2 years, the next time you have one, there may be something different that wasn't there before. Therefore, that's why screening tests are important. So it's your body. Use it to the best of your ability. Keep it healthy and take care of yourself.